If you have lumbar spinal stenosis, standing or walking for long periods might be getting harder. But did you know there are certain mistakes that may be making the problem worse? In this video, I'll share the top 3 mistakes to avoid and what to do instead to help relieve your symptoms. The first mistake is doing excessive backward bending. That may be doing backward bending exercises like that, or doing backward bending exercises like the cobra. And many people do these type of exercises thinking that it's good for their back. Often they're told to do that by physical therapists, and although backward bending exercises are good for some types of back pain, they're bad for spinal stenosis because this backward bending movement actually further narrows the spaces where the nerves come out of your back and can make your back and leg symptoms even worse. So you definitely want to avoid backward bending exercises if you have spinal stenosis, but if you're standing with a lot of arch in your lower back, that also creates extension. So when you're standing, you want to actually decrease the arch in your lower back. That allows you to stand for longer periods of time, for example, cooking dinner or washing dishes. Additionally, doing forward bending exercises can help. Many people are told that forward bending is bad for your lower back. But in the case of spinal stenosis, it actually opens up the spaces where the nerves come out and often relieves your symptoms. So if you do start having some pain and you don't have anywhere to sit down, often just bending forward either like that or bending all the way forward like this can actually help relieve your symptoms. Furthermore, doing exercises where you pull your knees up to your chest like that, either both knees or one knee at a time, that also helps to flatten the curve of your lower back and often relieves symptoms if you do have spinal stenosis. The child's pose, where you're on all fours and rock back like this, is another forward bending or spinal flexion exercise that helps relieve symptoms if you have spinal stenosis. And yet another good exercise is to do forward bending in a sitting position. This is often the go-to that I tell people if they start having pain, is to find a chair and to bend forwards and lean down. That often opens up the spaces around your nerve roots and relieves pain rather quickly. Now, just sitting in a chair, if you try to flatten your lower back into the backrest of the chair, that also helps relieve pain. Sitting is a very comfortable position for many people with spinal stenosis because it does put you in more of a relative spinal flexion position, which takes pressure off of your nerve roots. But that brings us to the second mistake, which is actually sitting too much. If you sit too much for too long, that makes your hip flexor muscles stiff. Your hip flexor muscles run from your spine down to your hips and also from your pelvis to your hips. The spinal portion is called the psoas, the pelvic portion is called the iliacus, and combined together that makes up the iliopsoas. Now the problem with getting a stiff iliopsoas is that when you do go to stand back up, it pulls you into a forward pelvic tilt and spinal extension, which again starts to narrow the spaces where the nerve roots come out of your spine. So a good thing to do is stretching your iliopsoas muscle. You stagger one leg backwards and one leg forwards, and then roll your pelvis underneath like that to flatten out your lower back. Drive your hips forward, and you actually kind of strengthen your glutes while doing this, while stretching the iliopsoas on this side. Hold the stretch for about a minute, and then repeat on the opposite side. Roll the pelvis under, drive the hips forward, squeeze the glute, and hold for about a minute. Now that helps put you in the position that you need to be when walking. And if your hip flexors are too stiff when walking, they'll pull you into a spinal extension position, which limits your ability to walk for long periods of time. But walking is actually one of the best exercises for spinal stenosis, even though it's often the most bothersome. In order to walk more comfortably, I'll give you one great but somewhat unpopular recommendation. and that's to walk using a wheeled walker. Now, this isn't to say that you have to use it all the time, and I don't want you to become dependent on it. So don't click off of this video thinking that I don't want to use a walker because it makes me look old, I'll become dependent on it. Just use it to allow you to walk longer for exercise. And by being able to walk for longer periods of time, you become more able to walk longer without the wheeled walker. And it'll prevent you from becoming reliant on needing the wheeled walker for just everyday tasks. Now, to use a wheeled walker to walk for exercise, you want to unload your weight. So you do get a little bit of an arm workout pushing down on it. That helps take pressure off of your spine to relieve compression and allow you to walk for longer periods of time. It also allows you to lean forwards just a little bit on the wheeled walker, kind of like leaning on a grocery cart at a grocery store, which many people with spinal stenosis do intuitively because it makes them feel better. You also want to think about getting hip extension. So pushing through your glutes like that, kind of like when doing the hip flexor stretch, that allows you to get some hip extension and stretch out your iliopsoas while getting your cardiovascular, your heart rate up, and doing other cardiovascular exercises such as using a recumbent bike or a seated elliptical are also good things to do, but you're in a flexion position for those and you don't get a stretch on your iliopsoas. Furthermore, when you exercise on an exercise bike or a seated elliptical, we don't spend our life in that position, or at least you probably don't want to. So if you want to be able to stand and walk for longer periods of time, you have to stand and walk for longer periods of time. And starting with a wheeled walker is one way to make it easier to do that. Now, I did mention with the walker that when you use it, you can use your arms to decompress your spine. And that's actually the third mistake that you want to avoid, is doing spinal loading activities that load your spine into compression. That would be things like weighted squats with a barbell across your neck, or overhead presses in a standing position where you're pushing up like that. That actually axially loads your spine, so it pushes down on it while you're in a standing extension position. And activities like that can actually make your back pain worse. Now, lifting weights is actually good for your bone and muscle health. So you don't need to avoid weightlifting altogether. But if you're going to be doing overhead presses, do it in a seated position where your back is supported and your spine is also in more of a neutral to relative flexion position. Instead of doing loaded bodyweight squats where you have a barbell or dumbbells over your shoulders like this, practice doing a hip hinge with dumbbells at your side instead, where you're hinging down like that, keeping your spine in a neutral position and then driving your hips forward. So this isn't a back extension exercise, which again is bad for your lower back, but instead a hinge at the hips where you push your hips back and squeeze your glutes and hamstrings to drive your hips forward, keeping your abdominals tight to keep your spine in a nice neutral position. So those were the 3 things to avoid if you have spinal stenosis, plus what to do instead. If you'd like more tips to relieve spinal stenosis, check out this playlist over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.